Hello, my name is Russell Patterson, and I'm an independent pharmacy owner and the founder of Exemplar Health. Exemplar has put together a network of independent pharmacies and independent physicians nationwide. The network is put together on two basic principles that all of us business owners have. We want more lives and better reimbursement. For us to understand how we can do that, let's look at what our competitors have put together in the healthcare market design that they've created. Once we understand that healthcare market design, then we can actually look to see what can we do to put together and cause a paradigm shift in our industry. First thing that we look at is what has CVS put together. CVS has leveraged their 8,000 pharmacies nationwide. They've put together a medical and prescription plan that brings more lives to their network. They also have sourcing group, Red Oak. Red Oak actually is part of Cardinal, which uses the independence volume in order to shore up Cardinal and give them better cost of goods. Walgreens thought this was such a great idea that they leveraged their 9,000 pharmacies, put together a medical and prescription plan with Cigna and Express Scripts in order to bring more lives to their network. They also utilize WBAD as their sourcing group, which partners with AmerisourceBergen to help bring volume from the independents and give a lower cost of goods to Walgreens. So as we look at these two models, we see that independent pharmacies have been left out. What we end up being is 1099 associates for our competitors. If you think about it, every time a patient walks in our doors, they have our competitors' insurance. We turn and we fill their prescriptions utilizing prescription drugs that are going to make our competitors even stronger against us. So instead of being a 1099 associate, what we would like to do is introduce a network that we have put together that allows us to become a paradigm shift in the industry, Exemplar. So what do we do to compete? We have to create our own network. Exemplar is a network for independent pharmacies and independent physicians. The network is synonymous with the name paradigm shift. The paradigm is that we don't want to work for our competitors anymore. We want to work for ourselves, bringing more lives and better reimbursement to our network. Let's explore how we can actually accomplish this. So what do we need to do in order to compete? We need to build our own network, creating a structure that works for our competitors, but can work even better for us. With that perspective in mind, I'm inspired to create and welcome the Exemplar Healthcare Partnership Organization. As a synonym for paradigm shift, Exemplar was designed to disrupt how we are currently operating and to connect independent pharmacists and independent physicians nationwide. That's about 25,000 independent pharmacies and 76,000 independent physicians nationwide, along with our Exemplar Pharmacy Management Services, Pharmacy Benefits Management Services, health insurance, and sourcing partners. Together, we all demand two things: more lives and better reimbursement. Let's look at how Exemplar can bring more lives to the network. In order to do that, we need to look at the way in which pharmacists and physicians get paid. We get paid in 4 different buckets. There's a commercial, Medicare, and Medicaid, and finally cash. Exemplar works in the first 3. Let's look at commercial plans to understand how a commercial plan works. First, I want to explain what the opportunity is in commercial plans. There's roughly 5 million companies in the United States, and only 30% of them offer self-funded plans to their associates. One of the chief reasons that they do not offer these plans is because of cost. So let's look at how we can service those customers and also pull lives from our competitors. First, we need to understand how commercial insurance works. There's several different companies that make up commercial insurance. The first is brokers. Brokers go out to companies and they sell them on the different types of insurance that they want to use. The next piece is a TPA, or third-party administrator. Third-party administrator is the paying source. They pay both the medical and the prescription side. TPA then uses an MGU, or managing general underwriter. These are our actuaries that determine the premium for the plan. The MGU then works with a reinsurer or stop-loss carrier to protect the plan from catastrophic type events. As you can tell, there's several different pieces of this to produce a commercial plan. The unique perspective that Exemplar has is that we actually own the vast majority of these companies. That gives us vertical integration. By vertically integrating as a health plan, we can stack margin and we can control the cost that we're using in the commercial plan. This gives us a competitive advantage. So this is how we plan to bring more lives in the commercial area. Commercial insurance, though, is not done every day. This is something that's an annual renewal. So it's a slow roll for the independent pharmacies in our network. So we need to look at something that can bring lives, more lives and better reimbursement quickly. Secondly, let's look at the Medicare bucket. In the United States, there are roughly 64 million Medicare patients. In our independent pharmacies, there are roughly 23 to 25,000 independent pharmacies across the United States. There's on average about 1,000 Medicare patients per pharmacy. This means that there's 23 to 25 million Medicare patients in our network, almost half of the total patient population in the United States. This represents an incredible opportunity for our network. What we have to do is we have to understand how can we work with those patients and bring more lives immediately to our network, and then also what is our long-term plan to continue to bring lives to our network. In the here and now and the immediate need, we work with those 1,000 patients. We bring a Medicare-approved agent to each one of the pharmacies, and they work with those 1,000 patients. They do a Medicare review. They're looking to see if any of those patients qualify for low-income subsidy. What we're actually finding is 20 to 25% of our patient population qualifies for extra assistance from the government, and they don't even know it. Another incredibly important patient population in the turning 65. These are patients that are having their birthdays and turning 65, and we don't even know that they're doing this. The big part that this plays is that almost 60% of those patients are leaving our pharmacies and going to our competitors. Why are they doing this? Because no one's working with them to see if there's a plan, an optional plan, that they could be on to keep them in our stores. So in these two ways, we are bringing more lives to our network members in the here and now. But all of this is aimed at fostering a relationship with all of our Medicare patients so that we can work towards our ultimate goal, which is bringing our network our own prescription drug plan, PDP plan. Exemplar has put together a supplemental and PDP plan for 2021. This is what we are looking to do to bring more lives to the network through Medicare. The third bucket, Medicaid. Exemplar is working in the Medicaid arena to go through the RFP process or bidding process in each one of our states where it's an opportunity. Another part of the Medicaid programs that we're desperately looking at is the PACE program and the DSNP. There's more information to come on those areas, but these are things that we're trying to do in those areas to bring more lives to our network also. As you can tell, we've gone through 3 different ways that we feel like we are bringing more lives to the network. We've talked about the opportunity and how significant it is for each one of our members. But we never have talked about how can we pay ourselves better, the more reimbursement. We don't want just more lives, we want better reimbursement. Exemplar has set the bar for PBMs. We are requiring PBMs to produce 50% of their net profits back to the network. That's correct. We are making our PBMs pay 50% of their net profit back to the network, and that is distributed to the network members. So in doing this, we have actually been able to show you how we are bringing more lives and better reimbursement. But how can you join the network? First, we need all independent pharmacies and independent physicians to join the network and become active members to help us grow the Exemplar Healthcare Partnership Organization. Second, we require no binding partnership agreement with all members. Lastly, and most importantly, we request access to your patient data. This allows us to build a network together to garner more lives and better reimbursement. Let's recap what we've just gone over. Exemplar has put together a healthcare partnership organization. The network consists of independent pharmacists and independent physicians nationwide. We come together over 2 basic goals. We want more lives and we want better reimbursement. We've gone over the healthcare market design created by our competitors and how that's created a 1099 associate type atmosphere for all of us. We want to be exemplar. We want to create the paradigm shift. We want to move from working for our competitors to working for ourselves. We want to demand more lives and better reimbursement from our partners and from the network. How do we do that? As network members, we join the network. Each and every one of you has an opportunity to go to our website, exemplarhpo.com, and join the network. Someone will reach out to you and give you as much information as we possibly can about the network and all the things that we're doing in your area. Next, as you join and become a member, We want you to tell everyone that you know. Let them see what we're doing. Let them understand how we're trying to help independent pharmacies and independent physicians across the country. And lastly, we're asking you to work with those agents. They're commercial agents and they're Medicare agents that will be assigned to each and every one of your areas and in your pharmacies. We want you to work with them. They're going to help you grow those lives, bring those lives to you and to the network, and they're going to help us get better reimbursement. Thank you so much for the opportunity to become a network member myself, and I hope that I'll have an opportunity to work with each and every one of you in the network. Thank you so much.